Cardiovascular diseases in the elderly. Understanding and prevention. Cardiovascular diseases are among the leading causes of death and disability in the elderly. As we age, our cardiovascular system undergoes significant changes. Blood vessels become stiffer and less elastic, while the heart gradually loses its pumping efficiency. These changes increase the risk of developing conditions such as hypertension, atherosclerosis, coronary artery disease, heart failure, arrhythmia, and stroke. Alarmingly, many cardiovascular diseases progress silently, with no obvious symptoms until serious complications arise. In older adults, the ability to recover and adapt after a cardiovascular event is often lower compared to younger people, which can result in severe consequences if not detected and treated promptly. Understanding the characteristics of cardiovascular diseases in the elderly plays a crucial role in healthcare and prevention. Lifestyle changes, risk factor management, and regular health checkups can significantly reduce the incidence and mortality rates from heart-related conditions in the elderly population. 1. Hypertension in the elderly. Understanding for better prevention. What is hypertension? Hypertension, commonly known as high blood pressure, is a condition in which the force of the blood against the artery walls is consistently too high. For adults, a normal blood pressure reading is around 120/80 mmHg. When blood pressure remains at or above 140/90 mmHg, it is considered hypertension. In the elderly, hypertension is extremely common due to the natural aging of blood vessels, which lose their elasticity and become stiffer, increasing resistance to blood flow. Statistics show that over 60% of people aged 65 and older suffer from hypertension, a figure that highlights its seriousness and prevalence. Causes and risk factors. Hypertension often results from a combination of aging and long-term unhealthy lifestyle habits. Common causes include age. Blood vessels naturally stiffen with age. Genetics. Family history of hypertension increases risk. High salt intake. Excessive salt retains water, increasing blood volume and pressure. Obesity. Excess weight puts extra strain on the heart and circulatory system. Lack of exercise leads to poor cardiovascular function and metabolic issues. Chronic stress affects the nervous system and hormones, contributing to high blood pressure. Smoking and alcohol damage blood vessels and elevate blood pressure. Symptoms and silent killer nature. One of the most dangerous aspects of hypertension is its lack of clear symptoms, especially in early stages. It's often called the silent killer for this reason. However, some may experience persistent headaches, especially in the morning, dizziness, lightheadedness, palpitations, rapid heartbeat, shortness of breath, fatigue with exertion, insomnia or restlessness, nosebleeds, less common. These symptoms are often overlooked or mistaken for other age-related issues. Therefore, regular blood pressure monitoring is vital for early detection and control. Potential complications. Without timely treatment, hypertension can lead to severe complications. Stroke, the most serious and common complication, caused by a burst or blocked blood vessel in the brain, leading to paralysis, speech loss, or death. Heart failure. Chronic high pressure makes the heart work harder until it weakens, causing fatigue, breathlessness, and leg swelling. Heart attack. Blocked coronary arteries reduce blood supply to the heart, leading to heart tissue death and potentially sudden death. Vision loss. High blood pressure can damage retinal blood vessels, leading to blurred vision or blindness. Kidney failure. Damaged kidney arteries reduce filtering capacity, possibly requiring dialysis. Prevention and lifestyle management. Prevention is always better than cure. Managing risk factors and maintaining a healthy lifestyle can significantly lower the chances of developing or worsening hypertension. Healthy diet. Limit salt intake to less than 5 g day. Eat more fruits, vegetables, whole grains, fish, and legumes. Avoid fried foods, saturated fats, and fast food. Drink enough water and reduce alcohol and caffeine consumption. Regular exercise. Engage in light activities such as walking, tai chi, yoga, or cycling. Aim for at least 30 minutes of activity per day, 5 days a week. Maintain healthy weight. Obesity increases strain on the heart and vessels. Aim for a body mass index, BMI, of 18.5 to 22.9. Stress management. Avoid prolonged stress and anxiety. Practice meditation, read, listen to music, or spend time with loved ones. Avoid smoking and excessive drinking. Nicotine and alcohol cause vessel constriction and damage the heart. Monitor blood pressure regularly. Elderly individuals should check blood pressure at least once a week or as advised by a doctor. If diagnosed with hypertension, take medication regularly and follow medical guidance. Family and community support. Elderly patients need the support and supervision of family members in managing hypertension. Reminders for medication, assistance with diet and exercise, and monitoring health indicators are vital. Additionally, community health programs should provide free blood pressure screenings, health education, and nutritional counseling to raise awareness and improve quality of life for the elderly. Issue 2. Atherosclerosis in the elderly, the silent threat to the heart. What is atherosclerosis? Atherosclerosis is a chronic condition where fatty deposits, mainly cholesterol, calcium, and inflammatory cells build up on the inner walls of arteries. These plaque deposits narrow the arteries and restrict blood flow to vital organs like the heart, brain, kidneys, and limbs. In older adults, this process occurs silently over many years. Symptoms only appear when an artery is significantly narrowed or blocked. Atherosclerosis is a leading cause of heart attacks, strokes, and other serious cardiovascular diseases. Causes and risk factors. Atherosclerosis is triggered by a mix of factors, most notably high cholesterol, dyslipidemia, excess LDL, bad cholesterol, and low HDL, good cholesterol, promote plaque buildup. Hypertension damages artery walls, allowing plaque to form. Diabetes disrupts fat and sugar metabolism, harming vessels. Smoking causes inflammation and vessel narrowing. Aging. Older age increases risk due to vascular degeneration. Physical inactivity and obesity raise cholesterol and blood pressure. Unhealthy diet, high in saturated fats, sugar, and salt contributes to plaque formation. Atherosclerosis in the elderly, a silent but dangerous progression. How does atherosclerosis progress? Atherosclerosis typically develops in 3 stages. 1. Initiation. Damage to the arterial wall occurs due to high blood pressure, smoking, high cholesterol, or other harmful factors. 2. Plaque formation. LDL cholesterol penetrates the inner layer of the artery wall, becomes oxidized, and triggers inflammation. This leads to the formation of atherosclerotic plaques. 3. Blockage or plaque rupture. Over time, plaques grow larger, narrowing the arteries. In some cases, they rupture and form blood clots, which can completely block blood flow, resulting in heart attacks or strokes. Symptoms of atherosclerosis. In its early stages, atherosclerosis often presents no noticeable symptoms. Symptoms usually appear only when the artery is narrowed by 70% or more, or when an acute blockage occurs. Symptoms vary depending on which arteries are affected. If it affects coronary arteries, heart, chest pain, angina, especially during physical exertion, shortness of breath, fatigue, in severe cases, heart attack, intense chest pain, cold sweats, fainting. If it affects cerebral arteries, brain, dizziness, slurred speech, weakness or numbness on one side of the body, can lead to an ischemic stroke if the artery is completely blocked. If it affects peripheral arteries, legs, leg pain while walking, known as claudication, cold feet, slow healing wounds. With serious complications of atherosclerosis. Atherosclerosis doesn't only affect the heart, it can damage multiple organs. Heart attack, myocardial infarction, caused by blockage of a coronary artery, leading to death of heart muscle, can result in sudden death if not treated immediately. Stroke, caused by blocked or ruptured brain blood vessels, leads to unconsciousness, paralysis, and speech impairment. The leading cause of disability in the elderly, chronic kidney disease. Atherosclerosis of the renal arteries reduces blood flow to the kidneys, leading to progressive kidney failure. Limb necrosis. Prolonged blockage in leg arteries causes tissue death, possibly requiring amputation. Diagnosis of atherosclerosis. To diagnose atherosclerosis accurately, doctors may recommend blood tests, check cholesterol, triglycerides, blood sugar, electrocardiogram ECG, detects ischemia, lack of blood flow, to the heart, Doppler ultrasound, measures blood flow and detects blockages in arteries, coronary angiography or CT angiography, pinpoints the location and severity of arterial narrowing. Prevention of atherosclerosis in the elderly. Prevention is key to helping elderly individuals maintain good health and avoid complications. The following measures are essential. 1. Healthy diet. Reduce saturated fats. Avoid animal fats, organ meats, fried foods. Increase fiber. Eat green vegetables, whole grains, fresh fruits. Limit sugar and salt, especially important for those with hypertension or diabetes. Eat fish 2 or 3 times per week, rich in omega-3 fatty acids that help lower LDL cholesterol. 2. Maintain a healthy weight, helps improve fat and sugar metabolism. Ideal BMI for Asians, 18.5, 22.93. Regular physical activity. Activities such as brisk walking, tai chi, swimming or cycling for at least 30 minutes daily improves circulation and vascular health. 4. Avoid smoking and limit alcohol. Smoking damages the inner lining of arteries and accelerates plaque buildup. Excessive alcohol raises blood pressure and triglyceride levels. 5. Routine health checkups. Monitor blood pressure, blood sugar, and cholesterol regularly. Screen for cardiovascular risks, especially if there's a family history or chronic illness. 6. Adherence to treatment. Take medications as prescribed by the doctor. Do not stop medications without medical advice, even if feeling well. Atherosclerosis is a silent disease with potentially life-threatening outcomes if not detected and managed early. In the elderly, whose immune function and cardiovascular resilience are already weakened, it can lead to sudden complications like heart attacks or strokes. However, with proper lifestyle modifications, regular monitoring, and effective medical care, atherosclerosis can be prevented and controlled. The support of family members is also crucial, providing reminders, emotional encouragement, and help with daily routines to enhance both longevity and quality of life. So, to coronary artery disease in the elderly, a silent threat to the heart. What is coronary artery disease? CAD. Coronary artery disease is a condition in which the coronary arteries, responsible for supplying blood to the heart, become narrowed or blocked due to the buildup of atherosclerotic plaques. As blood flow to the heart decreases, the heart muscle receives insufficient oxygen and nutrients, leading to myocardial ischemia. This is the leading cause of cardiovascular-related death in the elderly. CAD often progresses quietly over many years and is typically diagnosed only after severe complications like heart attacks or heart failure occur. Coronary artery disease in the elderly. Causes of coronary artery disease. Most cases of coronary artery disease, CAD, originate from atherosclerosis, a condition in which cholesterol, calcium, and other substances build up to form plaques inside the arteries. Major risk factors include age. People over 60 are at higher risk due to aging blood vessels. Hypertension damages arterial walls and accelerates plaque formation. Dyslipidemia, high LDL, bad. Cholesterol, low HDL, good cholesterol. Diabetes damages the endothelial lining and promotes inflammation. Smoking constricts blood vessels, raises blood pressure, and accelerates atherosclerosis. Overweight and obesity increases cardiac workload and metabolic disorders. Sedentary lifestyle, high intake of fats, sugars, and salt. Chronic stress affects autonomic and hormonal regulation. Symptoms of coronary artery disease (CAD) may progress silently for years without clear symptoms. When the artery narrows where 70% symptoms often appear, especially during exertion, e.g. climbing stairs, brisk walking. Common symptoms include angina pectoris, chest pain, a sensation of pressure, heaviness, or squeezing in the center of the chest. O may radiate to the left shoulder, neck, jaw, or arm. O triggered by exertion, stress, or a heavy meal, and relieved by rest. Shortness of breath with activity. Fatigue, dizziness, palpitations, or rapid heartbeat. In the elderly, symptoms may be atypical: general fatigue, loss of appetite, insomnia, or epigastric discomfort mistaken for gastric issues. Common types of coronary artery disease. 1. Stable ischemic heart disease, stable angina, triggered by physical exertion, relieved by rest, manageable with medication and lifestyle changes. 2. Unstable angina, occurs even at rest. Pain is more severe and prolonged. High risk of progressing to myocardial infarction. 3. Acute myocardial infarction, heart attack, complete blockage of a coronary artery, heart muscle necrosis, a medical emergency with high risk of death. 4. Heart failure from chronic ischemia. Complications of coronary artery disease. If left untreated, CAD can lead to serious complications. Myocardial infarction, part of the heart muscle dies due to lack of blood flow, high mortality risk. Heart failure, weak heart cannot pump sufficient blood, fatigue, edema, breathlessness. Arrhythmias, may cause fainting or sudden cardiac arrest. Sudden cardiac death, often due to ventricular fibrillation or arrest. Diagnosis of coronary artery disease. Doctors rely on both clinical and diagnostic tests to confirm CAD. Electrocardiogram (ECG) detects signs of myocardial ischemia. Echocardiogram assesses cardiac function and valves. Cardiac enzymes (troponin), key in diagnosing heart attacks. CT coronary angiography or invasive coronary angiography, gold standard for locating and assessing blockages. Treatment of coronary artery disease. Treatment aims to relieve symptoms, prevent heart attacks, and improve quality of life. Two main approaches: medical management, medications, nitrates, relieve chest pain, antihypertensives, ACE inhibitors, beta blockers, statins, lower cholesterol levels, antiplatelet agents, aspirin, clopidogrel, prevent clot formation, interventions or surgery. Percutaneous coronary intervention, stenting, opens narrowed arteries. Coronary artery bypass graft, CABG, uses a vessel from another part of the body to bypass the blockage. Prevention of coronary artery disease in the elderly. Early prevention slows atherosclerosis progression and reduces severe complications. Lifestyle modifications. Healthy diet, reduce saturated fats, increase vegetables, whole grains, fish. No smoking, limit alcohol intake. Daily gentle exercise, walking, yoga, tai chi. Maintain a healthy weight. Adequate sleep and stress management. Control risk factors. Routine checks. Blood pressure, lipid profile, blood sugar. Manage chronic conditions, diabetes, hypertension, dyslipidemia. Adherence to treatment if already diagnosed. Take medications as prescribed. Never skip or alter doses. Attend regular follow-ups to monitor disease progression. Coronary artery disease is a common and serious chronic cardiovascular condition in the elderly. Though often silent at first, it can result in heart attacks, heart failure, and sudden death when it progresses. However, with proper knowledge, early detection, and timely treatment, elderly individuals can maintain good health, remain active, and enjoy longer lives. Start with simple steps. Eat healthily, stay physically active, get regular checkups, and follow medical advice diligently. Gesundheitsgefährdete heart failure in the elderly. When the heart can no longer keep up. What is heart failure? Heart failure is a condition in which the heart cannot pump enough blood to meet the body's needs, leading to blood congestion and reduced oxygen supply to organs. In the elderly, heart failure is often the end result of chronic cardiovascular conditions such as hypertension, coronary artery disease, valvular disorders, and arrhythmias. It causes fatigue, breathlessness, and edema, severely impacting quality of life. Causes of heart failure in the elderly common. Causes of heart failure include chronic hypertension, makes the heart work harder, thickened heart muscle, reduced efficiency. Coronary artery disease, ischemia, leads to myocardial damage and weakening. Myocardial infarction, destroys parts of the heart muscle, reduced contractility. Chronic arrhythmias, too fast or too slow heartbeats impair blood flow. Valvular heart disease, causes abnormal blood flow within the heart. Cardiomyopathies, dilated or stiff heart muscle. Diabetes, obesity, and chronic anemia also contribute. Types of heart failure. Heart failure can be classified as by function: left-sided heart failure, pulmonary congestion, breathlessness, cough, pulmonary edema. Right-sided heart failure, venous congestion, swollen legs, abdominal distension. Combined global heart failure, both sides affected, complex symptoms. By progression stage, AHA classification. Stage A, high risk but no heart damage yet. Stage B, heart changes present, no symptoms. Stage C, symptoms appear during exertion. Stage D, severe symptoms even at rest. Mang symptoms of heart failure in the elderly symptoms usually start subtly and worsen over time. Subjective symptoms, breathlessness, initially on exertion, later even at rest. May occur at night, needing upright posture to breathe. Chronic fatigue, due to poor oxygen delivery. Palpitations, reduced physical capacity. Slower movements, can't climb stairs. Poor appetite, bloating. Objective signs, swelling of feet, ankles, abdomen. Rapid weight gain, fluid retention. Enlarged liver, abdominal distension, decreased urination. Complications of heart failure. Uncontrolled heart failure can lead to serious complications. Acute pulmonary edema, emergency condition with severe breathlessness, cyanosis, can be fatal. Arrhythmias, rapid heartbeats, atrial fibrillation, fainting, deep vein thrombosis, pulmonary embolism. Chronic kidney failure, from prolonged poor blood flow to kidneys. Sudden cardiac death, often due to ventricular arrhythmias. Diagnosis of heart failure. Diagnosis is based on clinical evaluation and tests. Electrocardiogram, ECG, assesses rhythm and ischemic signs. Echocardiogram, measures chamber size, pumping function, ejection fraction, EF. Alcar, blood tests, OBNP, NT, proBNP, specific markers for heart failure. Kidney function, electrolytes, cardiac enzymes. Chest X-ray detects cardiomegaly, pulmonary edema. Cardiac MRI or coronary angiography if needed for deeper investigation. Treatment of heart failure in the elderly goals are to relieve symptoms, prevent hospitalization, and extend life. Lifestyle adjustments. Limit salt and fluid intake if severe edema. Light, frequent, easily digestible meals. Maintain a stable weight. Avoid overexertion, rest appropriately. Medications. ACE inhibitors or ARBs, reduce heart strain. Beta blockers, bisoprolol, carvedilol. Slow heart rate, reduce oxygen demand. Diuretics, reduce swelling and breathlessness. Positive inotropes, improve heart pumping, used in severe cases. Anticoagulants, if atrial fibrillation is present. Doses should be carefully adjusted in the elderly due to risk of side effects and drug interactions. Interventions and surgery, if needed. cardiac resynchronization therapy, CRT, or implantable defibrillator, ICD, coronary interventions or valve surgery for specific causes. Atrium, preventing heart failure in the elderly. The key to preventing heart failure is early control of underlying heart conditions, control cardiovascular risk factors, manage hypertension, diabetes, and cholesterol effectively. Routine checkups for coronary and valvular disease screening. Healthy lifestyle. Moderate salt intake. Avoid saturated fats. Regular gentle exercise. Walking, tai chi, yoga. No smoking. Limit alcohol. Stress management and mental wellness. Adherence to treatment. Take medications as directed. Never stop on your own. Regular follow-ups and heart function monitoring. Heart failure is serious but manageable. In the elderly, teamwork among doctors, patients, and families is essential for improving quality of life, avoiding hospitalizations, and reducing mortality. Maintaining a healthy lifestyle, regular health checks, and managing chronic conditions are the golden keys to helping older adults live longer and healthier lives. What is a stroke? A stroke, also known as cerebrovascular accident, is an acute condition in which the brain is damaged due to a sudden interruption of blood flow, leading to oxygen deprivation and rapid brain cell death. It is one of the leading causes of death and disability in the elderly. Strokes occur suddenly, often without warning, and can cause severe consequences such as paralysis, speech impairment, cognitive decline, or even death if not treated promptly. Types of stroke. There are two main types of stroke. Ischemic stroke accounts for about 85% of all strokes occurs when a blood vessel supplying the brain is blocked by a blood clot, atherosclerotic plaque, or embolus, reducing blood supply to a part of the brain. Common causes include cerebral atherosclerosis, hypertension, atrial fibrillation leads to blood clots. Hemorrhagic stroke. About 15% of cases happens when a blood vessel in the brain bursts, causing bleeding into brain tissue or surrounding spaces. This type tends to be more severe and has a higher risk of death. Common causes include uncontrolled high blood pressure, brain aneurysm, head trauma, improper use of anticoagulants. Risk factors in older adults. The older a person gets, the higher the risk of stroke. Common risk factors include hypertension, the #1 cause of stroke, heart conditions, atrial fibrillation, valvular disease, myocardial infarction, diabetes, high cholesterol, smoking, alcohol consumption, sedentary lifestyle, obesity, history of stroke or TIA, transient ischemic attack, chronic stress, insomnia. In older adults, multiple comorbidities and vascular aging significantly increase the risk compared to younger individuals. Early warning signs of stroke. Recognizing stroke symptoms early and getting treatment within the golden window, first 4.5 hours, can save lives and reduce long-term damage. Use the FAST rule, EF, face, facial droop or uneven smile, A, arms, arm or leg weakness on one side, S, speech, slurred or incoherent speech, difficulty understanding, T, time, time to call emergency services immediately. Time is brain. Other warning signs include sudden, severe headache of unknown cause, dizziness, loss of balance, sudden vision loss in one or both eyes, confusion or loss of consciousness. These symptoms may be brief, e.g. in TIA, but still require urgent medical attention as they can precede a major stroke. In dangerous complications of stroke, untreated stroke can cause serious and permanent complications. Paralysis or weakness on one side of the body, speech and language disorders, memory loss, cognitive impairment, post-stroke depression, difficulty swallowing, malnutrition, death, especially with hemorrhagic strokes. In elderly patients, the risk of death after a stroke is 3 to 4 times higher than in younger individuals, and motor recovery is often limited if treatment is delayed. Diagnosing a stroke. Quick and accurate diagnosis is critical for appropriate treatment. Neurological examination, brain imaging, CT scan or MRI to differentiate ischemic versus hemorrhagic stroke, blood tests, glucose, cholesterol, kidney liver function, carotid Doppler ultrasound, ECG, echocardiogram to detect heart-related causes. Principles of stroke treatment. Treatment depends on stroke type and how quickly the patient arrives at the hospital. Ischemic stroke. Intravenous thrombolytics, RTPA, within 3 to 5 hours. Anticoagulants, antiplatelet agents, blood pressure, blood sugar, and oxygen management. Endovascular thrombectomy for large vessel occlusion, hemorrhagic stroke, strict blood pressure control, neurosurgery for large hematomas or brain compression, intensive supportive care. After emergency treatment, patients require long-term rehabilitation to restore motor function, speech, and psychological well-being. Irin, de sukewafen Lichorchi stroke prevention in the elderly prevention is always better than treatment. Older adults should manage chronic conditions, hypertension, monitor BP, take medication regularly, diabetes, control blood sugar, eat sensibly, high cholesterol, healthy diet, use lipid-lowering drugs if needed, atrial fibrillation, heart disease, take anticoagulants as prescribed, adopt a healthy lifestyle, low salt, fat, and sugar, eat more vegetables, fish, whole grains, gentle daily exercise, walking, tai chi, swimming, get enough sleep, manage stress, avoid smoking and limit alcohol, stay hydrated, especially in hot weather, regular checkups, at least once or twice a year to detect and manage risk factors. Patients with a history of stroke should be closely monitored to prevent recurrence. Such a stroke is a life-threatening emergency that can devastate individuals and families. In older adults, proactive prevention, early recognition, and timely treatment are the keys to reducing death and disability. Always remember, time is brain. The sooner you act, the better the outcome. Most importantly, prevention is the best way to protect your brain and enjoy a healthy, fulfilling life in old age. Arrhythmias in older adults. When the heart loses its rhythm. What is arrhythmia? Arrhythmia is a condition where the heart beats irregularly, too fast, too slow, or erratically. A normal resting heart rate is 60-100 beats per minute. When the rhythm is disrupted, it affects blood circulation, particularly dangerous in elderly individuals with weakened cardiovascular systems. Sometimes asymptomatic arrhythmias can still lead to serious consequences, such as fainting, heart failure, stroke, or even sudden cardiac death if not diagnosed and treated promptly. Are common types of arrhythmias in the elderly: atrial fibrillation, AF. The most common arrhythmia in the elderly. Irregular chaotic atrial activity, blood stagnation, clot formation, 5x higher stroke risk, supraventricular tachycardia, SVT. Sudden rapid heartbeat, causing palpitations and dizziness. May resolve spontaneously or require medical intervention. Ventricular arrhythmias, EEG, PVCs, ventricular tachycardia, can cause palpitations, fainting, or sudden death in severe cases. Bradycardia, slow heart rate below 60 BPM, inadequate blood supply, fatigue, dizziness, fainting. Causes include aging conduction system, medication side effects, or thyroid disorders. Causes of arrhythmias in the elderly: aging makes the heart more vulnerable. Common causes include long-standing hypertension, coronary artery disease, heart attack, heart failure, electrolyte imbalances, e.g. potassium, sodium, drug side effects, e.g. cardiac meds, sedatives, endocrine disorders, hyperthyroidism, hypothyroidism, stress, anxiety, chronic insomnia, alcohol, caffeine, tobacco use, age-related autonomic nervous system dysfunction, Symptoms of arrhythmia. Symptoms can vary or be subtle. Common signs: palpitations or fluttering in the chest. Noticeable fast, slow, shown irregular heartbeat. Dizziness, lightheadedness, fainting or near fainting. Shortness of breath, fatigue, chest discomfort, decreased exercise tolerance. Dangerous complications of arrhythmia. Untreated arrhythmias can lead to stroke, clots from atria in AF traveling to the brain, heart failure, chronic inefficient pumping, fainting, falls, injury, sudden cardiac death, especially from ventricular arrhythmias. Older adults are more vulnerable to these complications due to fragile cardiovascular systems. Rush diagnosing arrhythmias. Diagnostic methods help determine the exact type. Electrocardiogram, ECG, records rhythm at the moment. Holter monitor, 24-48 hours. Continuous recording for intermittent arrhythmias. Electrophysiology study, maps heart's electrical activity for intervention. Echocardiogram, assesses heart structure and function. Blood tests, check electrolytes, thyroid hormones, cardiac enzymes, etc. Short-run arrhythmia treatment. Treatment aims to normalize rhythm, prevent complications, and improve quality of life. Medications, antiarrhythmic drugs, e.g. amiodarone, propafenone, digoxin, beta blockers or calcium channel blockers to slow heart rate, anticoagulants, especially in AF, to prevent stroke. Electrolyte correction, treat underlying causes, e.g. on thyroid disease. Elderly patients are more sensitive to side effects and drug interactions. Start with low doses and monitor closely. 2 cardiac procedures: pacemaker for severe bradycardia. Radiofrequency ablation destroys abnormal rhythm areas. Implantable cardioverter defibrillator, ICD, prevents sudden cardiac death from dangerous rhythms. Because preventing arrhythmias in the elderly prevention is vital, especially for those with existing heart conditions. Manage underlying diseases. Control hypertension, CAD, diabetes, and heart failure. Correct electrolyte or thyroid imbalances. Adopt healthy lifestyle habits. Balanced diet. Low salt, fat, sugar, high in fruits and vegetables. Limit coffee, alcohol, energy drinks. Quit smoking. Get enough rest. Manage stress. Gentle exercise. Walking, tai chi, yoga, regular checkups. Blood pressure checks, ECG, blood tests as prescribed. If diagnosed with arrhythmia, follow treatment strictly. Never stop medication without consulting a doctor. Arrhythmias in older adults are potentially serious but often overlooked due to subtle symptoms. With early detection, accurate diagnosis, and proper treatment, elderly patients can maintain a good quality of life and avoid complications such as stroke or sudden death. Comprehensive heart care, managing chronic conditions, maintaining a healthy lifestyle, and strict adherence to treatment are the keys to helping seniors keep a steady heart rhythm and enjoy a peaceful, happy old age.